Hi, my name is Meera Beharry, and I'm a pediatrician and adolescent medicine specialist. I started this channel to help people understand a little bit more about adolescent medicine and how adolescent medicine practices and concepts can help you in your practice when you see teens and young adults. I actually started this channel quite a while ago and ended up having to hit pause because I very quickly realized that a lot of people don't know about the subspecialty of adolescent medicine. Having been in academic settings pretty much my whole 20 plus year career, it was a bit surprising to me that folks didn't know about this field. So, we're going to start off with the basics, talking about what adolescent medicine is and how one becomes an adolescent medicine specialist. And then, as we go through some of the different videos and courses, I'll give you more information that is directly related to patient care. So, as many of you know, medical school starts off with usually 4 years of undergrad, regular college, doing all of the prerequisites for college, and then taking your MCATs, getting into a medical school somewhere, then doing a residency, focused subspecialty training. You finally get paid after all of this education to basically do all of the tasks of taking care of patients and start learning how to take care of patients yourselves. Depending on the residency, it's either 3 years or 5 years. A surgical residency is usually 5 years or more. Those of us who go into fields in primary care, pediatrics, internal medicine, OBGYN, tend to have shorter residencies than the surgical residencies. For a lot of adolescent medicine physicians, MDs and DOs, medical doctors and doctors of osteopathy, it is a 3 year residency in pediatrics, internal medicine, family medicine before we go into more training in adolescent medicine. So just to keep track, we've got 4 years of 4 years of undergrad, 4 years of medical school, then 3 years of a residency in peds, internal medicine, or family medicine. If someone did a residency in internal medicine or family medicine in the US, they can participate in a 2 year adolescent medicine fellowship. For those of us who chose pediatrics, like I did, it's a 3 year fellowship experience. For me, I was actually in a 7 year pre-med program right outside of high school. It was at that time called the Sophie Davis program and has now become its own medical school program known as CUNY Med. CUNY Medical School, City University of New York Medical School. And I graduated from SUNY Downstate in Brooklyn in 2001. I stayed on there for my pediatric residency from 2001 to 2004. Then I did what's called a chief resident year, which is a year where you're technically still in training and under the supervision of other attending physicians, but you're really functioning like an attending physician and you're responsible for some of the other residents. So that year of training was wonderful. Got to learn a lot from one of our attending physicians there about teaching and education. Really loved that, and also had other physicians who taught me a lot about the general practice of medicine and more of the global perspective. After my chief resident year, I took a year off. The initial plan was to do some work with Médecins Sans Frontières, Doctors Without Borders, but due to a variety of circumstances and the timing of when a placement was made available for me, I ended up creating my own opportunities. So I did some locums work in local community pediatric places, one in southern Westchester, which is where I grew up, and one in Mississippi, which is definitely not where I grew up and was very eye-opening. I also did a medical mission to Haiti. The story behind that is actually interesting. I decided to take some tropical medicine classes at Hopkins. And while I was there, I met one of the emergency medicine physicians who was also in that class. And she told me about a medical mission that they were planning to Haiti. Decided to add that onto my travel plans, also some like medical Spanish classes. So it was a wonderful year of seeing more of the different way that medicine is delivered in different parts of the world. After that gap year of a medical experience in different and atypical settings, I moved over to California for my fellowship in adolescent medicine at Children's Hospital Los Angeles. I chose to do my fellowship there because of the areas of focus for that fellowship program. The program at the time was led by Dr. Richard McKenzie, one of the pioneers in the field of adolescent medicine, and had a focus on youth experiencing homelessness, teens with chronic medical conditions, and young people experiencing parenting and pregnancy. And those were areas of focus and still are areas of focus for me in my practice. So 3 years of fellowship in Children's Hospital Los Angeles. Then I returned to the state of New York, upstate New York, at the University of Rochester to work with the great people in that revered institution. Among the folks I got to work with was Dr. Richard Kripke, past president of the Society for Adolescent Health and Medicine and past president of the Academy for Eating Disorders. Learned a lot about their approach to managing eating disorders, as well as community pediatrics in a city that is not the same as New York or LA in terms of funding and resources, but also a quite populous city. I learned that I also am not a fan of living in snow if I don't have to live in snow. So I decided to find another job in sunnier climates and ended up at a small children's hospital in Texas, McLean Children's Hospital, and worked there for 9 years from 2012 to 2021. Ran a small adolescent medicine department and pretty much did everything under the sun in adolescent medicine. Reproductive health care, putting implants in, IUDs, menstrual management, treating anxiety, depression, doing a lot of counseling and a lot of therapy, because that was what was needed in the area, certainly when I joined. Eating disorder treatment and management, breaking the ground on some of the treatment needs at that time for the inpatient and outpatient setting, as well as other needs that arose while I was there. In my fellowship at Children's Hospital Los Angeles, we trained alongside the psychologists, and they also trained alongside us. So we learned from each other a little bit of each other's skills. So I learned from the psychologists some therapeutic techniques and how to do some of the basic counseling and CBT skills in my practice. And they also learned a little bit more about the different medical conditions and how that can impact the health and well-being of the young person. This is something that I've brought to my practice and I keep in my practice to this day. And I think it's really central to all adolescent medicine folks. One colleague that I spoke with not too long ago said, if you've met one adolescent medicine person, you've met one adolescent medicine person. And that's true. There's only about 750 of us actively in practice, fewer than 1,000 of us who've ever been actually board certified and approved through fellowship and all the training processes. So we are very niche in the US, and there are only so many more of us around the world. So we've all had to do what we needed to do to adapt to our different settings and to really meet the needs of our community wherever we may end up. Most of us are in academic centers, and we have a profound love of teaching. It's why we do what we do. It's why we did these 3 years of fellowship and, had the experiences and focus that we do. This focus for a lot of us are focused on research or other activities. We love teaching is the end point. We love teaching residents, medical students, and of course, we love teaching our patients and our families. This is part of why I started this channel. I want to teach you a little bit more about adolescent medicine and how you can put this in your practice. So this is just a little intro to me, a little intro to why I made this channel. We'll talk a little bit more about fellowship, about all of the different things that are part of adolescent medicine training in different ways that one can get involved, even if you are not planning on doing a fellowship and making this the mainstay of your practice. As we go through this channel, we'll do some other tidbits talking about reproductive health needs of young people and how to address those in your practice, how to address some of the medical legal issues that come up, how to address anxiety, depression, eating disorders, really all the things in adolescent medicine that come up. I welcome your questions. I welcome your comments. This only works if I am meeting your needs, and I definitely want to do that. If you would like to communicate with me directly, please feel free to send me a message, write something in the comments, or send an email to adolescentmedicineconsulting@gmail.com, or give us a call, 254-718-7559. We welcome your questions, your input, and your comments, and hope that you will continue to follow this channel for more information on adolescent medicine. Thank you. Bye.